And if it meets the same criteria as a disorder at other ages, why would we call it temperament if the child is little and call it a disorder when they're older? Now, this isn't a matter of semantics. It's a matter of treatment and identifying children who are in such distress or are so impaired that they need some kind of help. So it's very important for us to sort out this issue. Now, again, here are data from our study showing how many kids are shy or inhibited with unfamiliar people. And it's tremendously common, as we would expect, and much more common in the 2-year-olds. But again, you see that the rate of kids who are also impaired who have that symptom is much less. And just to note, the rate of behavioral inhibition is 15%, and the rate of kids with separation fears and shyness and inhibition with new people is about 10 to 15%. So clearly we have some overlap here, and we have to untangle that. Another argument that's been made is that, okay, maybe preschoolers are going to have some anxiety syndrome, but they're not going to be as differentiated into different types as we see at other ages. And the evidence really doesn't support this. This is a table from 2 very large epidemiological studies, one with almost 800 preschoolers in Australia, and then another one with 4,500 preschoolers in England. And they're very similar. They did a factor analysis of symptoms, and these are the 5 anxiety factors: a separation factor, a social phobia one that has to do with obsessions and compulsions, a generalized anxiety or general distress factor, and then a specific phobia and fears. And what you note is that maps on quite nicely with the division of the anxiety disorders in the DSM. We did a factor analysis of the data from our study, and here in the box here are the emotional disorder factors that came out. And we found 3 different factors: a depression and generalized anxiety disorder factor, a social phobia factor, and a separation anxiety disorder factor. This very interesting confluence between GAD and depression is something that we do see at older ages, and we're working around some hypotheses that GAD in very young kids may be more akin to depression than the anxiety disorders that we see either in early childhood or later. And we've been exploring that hypothesis. So then we look at what are the distributions of these symptoms across the preschool period. And I'm just going to give one example here. And these are the symptoms of separation anxiety disorder. Here they are, going from the most common in the community down to the least common. And you see that 3 of the symptoms are present in from about 10 to 20% of preschoolers: reluctance to sleep alone, sleeping in the parent's bed; separation distress, avoiding being alone; and then some are very uncommon, like worrying about calamitous separation. But what one needs to remember is you do not make a diagnosis based on a symptom. It has to do with, for separation anxiety, having 3 out of 7 symptoms. Then you also have to meet duration criteria, onset criteria, etc. And here in our data, this shows the distribution of kids who have 0 SAD symptoms up to children who have 7. And I've put the arrow here at 3 to show that there are relatively few children who even meet the symptom cut point. And this doesn't make a diagnosis. You still have other criteria to meet. So that puts to rest some of our concerns that if we identify these symptoms in young children, we're going to be over-identifying children as having problems. Now I'm going to turn to the question of prevalence of these disorders in the community. And here are the rates of the 4 anxiety disorders that I've talked about in our community sample. And you see that they all are between about 2 to 2.5%. Now in blue here is a comparison of rates of these 4 disorders from a meta-analysis of all epidemiological studies of older children done since 1993. And what's striking is the rates are remarkably similar in preschoolers and in older children. Now here in light blue are the rates of these same 4 disorders from the National Comorbidity Study, which is one of the largest studies in the United States of rates of psychiatric disorder. Now, we see these differences. These have to do with whether or not you include impairment or not. But again, what you see is there certainly are not being overrepresented in these young children. And so it really addresses that question of whether we're overdiagnosing the problem. Now, I just want to make this critical point here. I am focusing on preschool anxiety disorders, but the similarity of the rates of disorders from early childhood to middle childhood and adolescence and then into adulthood is not confined to anxiety disorders. Here are the most common disorders. So here's anxiety disorders. Preschoolers are in red, older children in dark blue, and adults in light blue. And there are those differences that we see with an increased rate in adults, but for something like ADHD, the rates are remarkably similar. It's about 3 to 3.2%. We do see higher rates of disruptive behavior disorder in children overall, but that is something that we would expect. And we see higher rates of depression in adults in a sort of a stepwise fashion. But I'd like to point you down to the bottom here. These are people who meet criteria for a psychiatric disorder and are impaired, and that's the criteria that's required for children to get services or people to get services through many federally funded insurance programs. And what we find, and this was a bit of a surprise to us, is the overall rate of people with a diagnosis and impairment is remarkably similar from early childhood into adulthood. The rate is from about 11 to 12%. Now, this is very challenging to us, I think, both as clinicians, but also from a public health perspective, in thinking about how early do psychiatric disorders start and where should we be focusing our treatment and our prevention efforts, because the evidence is coming together to suggest that these things start very early and that maybe if we can treat them early, we can really stop people from having a lot of suffering that they experience later. Now I'm going to turn to the question about how similar preschool anxiety disorders are to the anxiety disorders at other age. So first of all, this is looking at rates of comorbidity. So most preschoolers, about 58%, only had one anxiety disorder. 16% had 2 or more anxiety disorder, and a quarter had an anxiety disorder and another disorder like depression, ADHD, or disruptive behavior disorder. And these rates are fairly similar, comorbidity rates are fairly similar to what we see at other ages. We also see that preschoolers with anxiety disorders are extremely impaired. Because, of course, we're not interested in counting symptoms. What we're interested in is what's clinically significant. Who are the children who need help now? We have an impairment scale in the PAPA that goes from 0 to 30. Preschoolers with no disorder have 1 on that scale on average. And you see for SAD, GAD, social phobia, and specific phobia that children with these disorders are much more impaired than children who don't have a disorder. But here we've added in depression in blue, ADHD, and disruptive behavior disorders. And what you see is that preschoolers with anxiety disorders are as impaired as children with either depression or the more commonly identified ADHD or disruptive behavior disorders. Now, what's interesting is it tends to be the disruptive, behaviorally disordered young children who get to the attention of pediatricians or child psychiatrists because they're being suspended from preschool or expelled from preschool or daycare. So their parents sort of realize that there's a problem, or the school realizes there's a problem, and the child goes to get help. With anxiety disorders, unfortunately, children clearly are impaired and suffering, but they often aren't coming to any kind of attention because they're not causing those kind of problems. This is just to show, in terms of specific impairments, that preschoolers with anxiety disorders are impaired across multiple domains in their relationships with parents, siblings, peers.